All right. So let's see. So today we were going to basically talk about what Dr. Loud had said the last time, which the question that she raised was, you know what, honey, let's just not worry about it. And I'll do the presentation. Hold on. I'm just going to wing it here. Hold on one second. Actually, do you guys mind holding for just another sec? Let me see.
No problem.
Okay.
Anybody else who has an Easter tradition they can share while we wait for Dr. Jones?
Let's see.
In the States, they've always done the bunny and the eggs, always?
I don't know. Have they always?
As far as I know.
Yeah. Where does the bunny come from, actually? Who came up with the bunny bring eggs? It's an interesting story.
All right. Well, let's just do this. I'm just going to do the best that I can here, and maybe I'll show you some of these slides.
Maybe you can point the camera.
Yeah, that's what I was thinking. Can we start this? Is it live enough for me to actually start the presentation? We're going to go old school, and I'm going to point the camera at it. No, it's totally frozen. I don't know why that would be. Nothing's open. Huh? Okay.
Okay, yes.
Oh, good. Okay. Well, that's at least something. Did it work? Okay, well, you know what? This is better than nothing. Okay, so here we go. I'm going to point this way, and I'm going to turn my screen this way and try to switch. Why do I not see it? Well, I do not get an A+ as far as technology goes. How come I can't switch it? Flip it. Thank you. What would I do without you? Okay, fantastic. So we're gonna just do it this way today. So welcome and thank you for being here and thank you for your patience. I don't know what's happening with my technology, but sometimes that gets the best of me. So we are gonna talk today about sleep disordered breathing and breath retraining. And the question, this is the problem, I can't close that. The question that Dr. Loud posed last time is, can functional breathing cure sleep apnea? And we're gonna explore that a little bit. And you're probably wondering why. I'm just gonna switch back to me. How come? Okay. Well, let me just acknowledge that this is not going how I hoped it would. So I'm sorry, but I'm just going to put it right here and I'll just talk you through it. So we're talking about sleep disordered breathing and breath retraining. And Dr. Loud asked the question the last time, can functional breathing cure sleep apnea? And you're probably wondering, why in the world is a dentist talking with you about breathing and sleep apnea? And the question really starts with, back in undergrad, I went to the University of Arizona and I was on the pre-med track, and basically we had to do research. And I decided to do research on sleep apnea because my grandpa had it, and I would go to his house and I would see him fall asleep in his chair and his mouth was wide open and he would stop breathing, literally stop breathing. And so that's where I got interested. And then when I graduated from college, I really wasn't sure what I wanted to do. So I moved to New York City to dance professionally. And I met my husband along the way on a national tour of My Fair Lady. What meant to be 1 year turned into 6. And then I decided, okay, now I want to go back into the science that I love. And so I was connected with a professor at NYU and got to start doing research there on sleep apnea. But as much as I loved it in undergrad, I hated it there because I was in front of a computer all the time. And obviously I'm not the best with computers, but I totally miss the person interaction, the people interaction that happens with everything. And so I thought, okay, this isn't it, but I still love this stuff. So again, I took some time off and we toured around the world. We performed on cruise ships. And then I decided, okay, that's okay. I can advance it. Sorry, I'm getting some awesome help from my husband here. So my mother mentioned dental school, and I thought, okay, well, that makes sense because it's kind of scientific and artistic. And so I decided to go to dental school and went to the Arizona School of Dentistry and Oral Health. I'll try starting this one more time so maybe you guys can see the slides. Okay, yeah, and now you see my finger, but let me switch it around and then maybe you can see a little bit of what I'm talking about. Okay, so here we go. So I went to the Arizona School of Dentistry and Oral Health, and that's really where I first got my exposure to oral health as part of overall health, and basically learned to look for all those connections and just absolutely loved it. Then I went to being a dentist and I had some kids, and my son especially had some sleep disordered breathing. He was basically having really restless sleep. He was waking up a lot. He had tangled sheets. He was snoring. He was not super concerned about getting out of nighttime pull-ups. And so I was learning all of this stuff about sleep disordered breathing in kids. And I happened to be friends with Dr. Lauren Ballinger, who is amazing in sleep dentistry with kids. And I was talking with her about getting some advice on how to treat him. And she said, okay, you be the mom and let me be the dentist on this one. And I'll tell you that she used the myobrace and expanded him. But that first night that he slept through the night with the myobrace was the first night that he had a dry pull-up and just really changed things. It was amazing. So I have been driven to come back to this sleep apnea stuff again and again. Who knew that it would come full circle for me in dentistry? But I was so inspired by Patrick McEwen, and I wanted to be a part of the Oxygen Advantage and Buteyko Clinic breathing instructors. And I've since gone to the American Academy of Dental Sleep Medicine and Healthy Start. And so I'm just really trying to put this all together. And I'm so excited that you're here. And I'm so excited that you're patient with all of my technical difficulties here. And I'm going to do the best that I can. So whole health dentistry, I just love Dr. Loud, and I'm so thrilled that she asked me to do this today. And her question was last time, can functional breathing cure sleep apnea? And I'm going to switch that question a little bit. And instead, I'm going to ask the question, can functional breathing cure sleep disorder breathing? So sleep disorder breathing, what is it? This book right here, I'm just going to say quickly, is fantastic. So this was written by another dentist, and he calls himself Ask the Dentist on social media. He shares some great information. But this book especially is such a short, quick read, so easy to understand, and is very helpful for a patient who thinks that they might have sleep apnea. So sleep disordered breathing is an insidious inflammatory disease that affects every system in the body. It's associated with the biggest killers in the Western world: high blood pressure, strokes, cancer, heart disease, Alzheimer's, diabetes, and even depression. So if you look, I don't know how well you can see since I'm not exactly doing this the best way, but there are so many systemic things that are related to having sleep disordered breathing. So all of these are the systemic things. And then if you look down here in blue, you have tooth decay, clenching and grinding, gum disease, acid erosion, and then even further down in the red, which hopefully you can see, there's depression and anxiety. So it's related to your overall health, your oral health, and your mental health. So where in the world does sleep apnea fit into all of this? Sleep apnea is within the spectrum of sleep disordered breathing. So if you're healthy, you start out with normal breathing, and then you progress down the spectrum and you start with snoring. So snoring is your first sign that there is an obstruction of some sort in the airway. And that's what you hear, is the air trying to come through a smaller space. Then you go up the spectrum and you have upper airway resistance. And then you go into obstructive sleep apnea, which can be mild, moderate, or severe. If you notice, there's insomnia that I put on both of these parts here. And the reason that it's on both parts is because insomnia can be a piece of obstructive sleep apnea where your body is so smart that basically it knows that if it lets you fall asleep, you will essentially stop breathing and somewhat suffocating while you're sleeping. And so who wants to do that? And your body is smart and it will actually keep you awake in order to prevent you from doing that. There's another type of insomnia, which is actually the difficulty that we have turning our brains off. So you were never meant to be in that fight or flight mode with a sympathetic go, go, go sort of on button all the time. And so if you have that, it's really hard to turn off because your cortisol levels, your adrenaline, your noradrenaline, everything is just off balance and you can't quiet your mind and go to sleep. So what is obstructive sleep apnea then? Obstructive sleep apnea is when the airway literally closes down while you're sleeping. So if we're looking at this picture here, my very high-tech finger, this, I wish this person had their mouth closed. You've probably heard me say that a million times, breathe through your nose. But if the normal airway is here, you have air going either through the nose or through the mouth, but it is able to flow all the way into your lungs. The problem is if you have sleep apnea, then you're going to have an obstruction. So usually it can be lots of things, but it could be that the tongue is falling back into the airway, the soft palate's falling back there. And interestingly, if you are on your back, it's going to be the highest risk for you to have sleep apnea and apneic events where you stop breathing because gravity is sort of working against you. And if you have your mouth open, you are more likely to have that tongue fall back and you actually will make the airway smaller by about 6 millimeters. So it is great to get a diagnosis, to know that you have it, but so many people don't. And 80% of the people that have sleep apnea are undiagnosed. There are 4 phenotypes of sleep apnea. So the first one is PCRIT, and that's essentially how collapsible is your airway. There's a pressure of the air coming into your lungs, and there's your pharynx, which is kind of unique in the fact that that part of your airway has absolutely no bony structure. So as you're inhaling, the muscles need to keep it open, and there's like 20 muscles that work to do that. But if the pressure is so great that it is more than what those muscles can keep open, then your airway will collapse. So someone who has a collapsible airway may not have that much tone in the muscle, or it may be a smaller airway, or lots of things can play into that. Loop gain is how sensitive is someone to carbon dioxide changes. And I'm just going to run through these quickly because they'll make a little bit more sense here. But the next one is upper airway recruitment, which is activation of the muscles to keep the airway open. And arousal threshold is how easily do you wake up. So a light sleeper would wake up after any small disturbance. You know that person who, it's me sometimes, where you hear the slightest noise. I think it happens after you become a parent and you just wake up. But the same thing can happen if you are one who's prone to sleep disorder breathing, and all of a sudden your airway is starting to get obstructed and you're a light sleeper. And so you wake up in order to be able to breathe, which is great because we want breathing to win. It's important. However, sleep is also important. And so if you're constantly waking up to be able to sleep, to be able to breathe, then you're not going to have very restful sleep and you're going to miss out on a lot of the things that need to be done in sleep. On the flip side, you don't want to be a deep sleeper either, because just imagine if you are sleeping and you stop breathing and you're such a deep sleeper that you don't wake up, that's obviously going to be bad as well. So what options exist to treat obstructive sleep apnea? We have positive airway pressure, and there's various ways this can be. So it can be constant, it can be automatic where it actually adjusts and it's more comfortable to breathe in. And so it's kind of like having a vacuum backwards. It pushes air into the airway to be able to pop it open so that you can breathe. You have jaw positioning, so you can move the jaws forward, and you can either do that with an oral appliance or you can do that with surgery to move the jaw forward. And then there is also Inspire, which is basically like a pacemaker for the tongue. It helps you bring that tongue forward by stiffening it and getting it out of the airway so that you can breathe. So a lot of these are sort of opening up the airway, bringing things forward so that you can breathe. And there's other surgeries that could be done too, like removing the tonsils or fixing a deviated septum, those sorts of things. But there's also breath retraining to establish functional breathing. So here's the original modified question that we asked again, which is, can functional breathing cure sleep disordered breathing? And I just have to say that I would never claim that. And yet there is so much that can be improved by establishing functional breathing during the day, especially because we can't control how we breathe at night, but the way that you breathe during the day certainly affects how you're going to breathe at night. And you're going to be breathing much better during the day than you are at night. So it's not magic that all of a sudden you're going to be able to breathe through your nose. You're going to be able to breathe. If you're not doing that while you're awake, you're certainly not going to be doing that while you're asleep. So what in the world is functional breathing? It's breathing light, it's breathing slow, and it's breathing deep. So where do we start with this? If I'm training people, what we usually like to do is the Bolt score or the control pause. They're the exact same thing. It just depends on whether you're talking about the Buteyko method or the oxygen advantage method. And essentially it's an objective score to figure out how tolerant you are to carbon dioxide changes. So what you do is you sit in a chair, you're breathing regularly, your normal pattern, you don't have to do anything to alter it. You pretend that you have a thread that's sort of pulling your head straight up so that you're sitting nice and tall. And you take a normal breath in and a normal breath out. You have your stopwatch from your cell phone in hand. You pinch your nose and you hold your nose until you have that first desire to breathe. So this is not to see how long you can hold your breath. It's to see how long it takes until you feel that first definite desire to breathe. And then you're going to let go. And hopefully you would be able to breathe a normal breath in and through your nose. So if your Bolt score is greater than 25 seconds, then that's usually a great sign that you have functional breathing. There's an 89% chance that you're doing great. You're probably not at high risk for sleep disorder breathing. But if you're less than 25 seconds, then that's an indication that you have some dysfunctional breathing. And that could include a lot of things. And it doesn't have to be all or nothing. There are Olympic athletes who have dysfunctional breathing. And so that could mean that you are breathing rapidly, you're breathing up in your chest, you may be mouth breathing, and it may be at different times that you're having this happen. And it could also be at night, because if you think about it, you are sleeping for 1/3 of your life. So what do we work on with breath retraining? We're going to work on nasal breathing at all times, because if you're breathing through your nose, you're going to be conditioning the air, which decreases airway inflammation. Because if you think about it, you are breathing in this air, and our air has all sorts of stuff in it, pollution, dust, it has, all sorts of bacteria and viruses and stuff. And our nose can humidify, disinfect, and warm that air and just condition it for our lungs. And so it's going to be less likely to cause inflammation in our airway. But if we're breathing through our mouth, we're going to have more inflammation in our airway, which means that it's going to be smaller. And if you already have a small airway to begin with, then that's going to make a small airway even smaller. So breathing through your nose can help with that. You're going to harness nitric oxide, which dilates the airway. So not only does nitric oxide disinfect the air, but it helps to open everything up. It promotes, and you only get that if you're breathing through your nose because it's produced in the paranasal sinuses. So I think someone just asked what the movement is, and it's the fact that I have technical difficulties right now, and I'm using my cell phone to show my computer. So I'm sorry if it's looking really weird. I can always switch to me. But there's going to be, with nasal breathing, it's also going to promote correct tongue posture. So you're going to close your mouth. You would have your tongue to the roof of your mouth. And that's going to be much more likely if you're breathing through your nose. If your mouth is open, you're almost always going to have your tongue down in the floor of your mouth, because I've never seen anyone really that has their mouth open, but their tongue up in the roof of their mouth. So when your tongue is up in the roof of your mouth, it's up and out of your airway. So it's up and out of the airway here versus being down and back in the throat. It's going to promote diaphragm breathing, and it promotes an open airway, and it eliminates mouth snoring. So I'm going to see if I can switch it around to me, because I don't know that you're getting a whole lot of value out of this.
No, it is helpful. Actually, Dr. Jones, that question came from me, and it was regarding your previous slide.
Oh, okay. And what was it?
Let me see. I was trying to ask, so you gave an indicator of which is better or worse when it comes to the carbon dioxide reaction. But what is, if you're having a quick reaction, does that mean you have too much carbon dioxide in your system already? Is that kind of what the practical sense, what it means?
Yeah, that's a great
Okay.
question. And how about I come back to that at
Perfect.
the end, 'cause there's
That's why I
kind
put
of
it in the
lots to
chat,
that.
because I thought maybe you would address it later. So
Oh, got it. I thought it was
Okay.
addressing the fact that this was, so it is helpful to see the slides, even though they're with me holding it.
it is for me.
Okay, perfect.
Yeah.
I'll keep it on there then. So I'm going to go back to this one. So we're going to talk about, this might answer it a little bit, but if it doesn't, you let me know. So what do we work on? We're also going to work on, like I said, light breathing. So this means that you're going to be breathing less air. So that's so counterintuitive, because most people think that they need to take a big breath or a deep breath, but essentially you want to become efficient at breathing. And if you're breathing in a lot of air, you probably aren't using it very effectively. And if you take a big breath and you look down at your chest, and especially if you take a breath through your mouth, you'll see that chest rise. And you really want that air to be getting all the way down into your lungs where the air sacs are. And so if you keep that up in your chest, you're going to be breathing a lot of air, but you're not going to be able to be using that oxygen and exchanging all that gas effectively. So breathing less air reduces carbon dioxide sensitivity, because as you're breathing, you're not breathing off as much carbon dioxide, which is your signal to breathe, and it builds up in your system, and that helps to change your chemosensitivity, and it lowers that loop gain, which is that one phenotype that we talked about. It decreases the amount of air in the system, which is related to PCRIT, because if you have less air going through a pipe, for example, and it's not going as quickly, it's going to be less likely to collapse that. So no engineer would ever think about, a tube of any sort and not think about what's going through it. So the rate that the air is going through and the amount of the air that's going through matters, and it can cause the airway to collapse. It helps to normalize both our rate and volume of breathing. So for example, with this one, if we were going through an exercise, breathing light, there's so many different ways to do it. There's about 4 variations of how you can do it. But you start by just noticing. You want to notice the cold air as it enters your nose and the slightly warmer air as it leaves your nose. And then you want to continue to notice the slightly colder air as it enters your nose and the slightly warmer air as it leaves your nose. And then you really just try to soften that. So you're not tensing up your muscles, you're just trying to soften the air that goes in and out of your nose, and see if you can make it so soft and so quiet that you don't even feel like the little hairs within your nose are moving at all. and see if you can just think about taking in a slightly smaller breath than you want to. Like you're creating almost a little bit of an air hunger, if you want to call it that, so that you wish that you could just take a little bit more breath and you're kind of feeling like, okay, you know, here's my air hunger, but you continue to breathe in and out of your nose gently and just soften your breath. So that's something that we would work on and continue. And as you do that, again, it helps to reset your carbon dioxide sensitivity. We also work on slow breathing because breathing slowly reduces carbon dioxide sensitivity again, which is related to your loop gain. It slows the air entering the system, which is related to your P-crit. And it, hopefully this is still working for you guys. And it activates the vagus nerve, which signals rest and digest. So we want to have the rest and digest because we're trying to rest. And if you have that one, you're going to be less likely to be aroused. So that comes into play with your arousal threshold. It helps to normalize your rate of breathing, and it decreases or eliminates nasal snoring. So Breath by James Nestor is another fantastic book. And in it, he talks about the ideal breath, which is 5.5 seconds in and 5.5 seconds out for a rate of 5.5 breaths per minute. But one of my favorite ones that I'm just going to do with you for a minute here, especially since we're talking about sleep and talking about relaxing, is sort of prolonging the exhale, because anytime that you prolong the exhale, that's going to trigger your vagus nerve even further. The other thing that can trigger your vagus nerve is humming. And so if you hum the letter N, that's going to put your tongue automatically in the correct position, the correct posture at the roof of your mouth. So you've already got that ready to go. And then you're going to breathe in through your nose and you're going to exhale and hum with your lips closed, so that you can, let me see if I can turn it towards me so you can see what I mean. Okay. So you're going to inhale, and we'll do a few of these together so you can see what it's like. You're going to inhale for 1, 2, 3, 4, and then you're going to exhale through your nose and hum. Then inhale through your nose, 2, 3, 4, and exhale humming. Inhale, 2, 3, 4, and exhale. So you can keep doing that if you want, but there's so many benefits to humming and to slowing the exhale. But humming also triggers the production of nitric oxide, which is great for disinfecting the air. But most importantly, it also dilates the airway, so it makes it easier for you to breathe. So you're turning on that rest and digest, you're dilating the airway, and you are triggering the vagus nerve and the parasympathetic rest and digest mode. So let me try to turn this around again, and we'll keep going. Hold on. Doop. There we go. Okay. Well, hopefully you didn't see the mess in my house. So low breathing is another thing that we work on. And this is different from taking a big breath. We want you to take a deep breath, and the amount of air that you breathe in and the rate matters. So if you slow your breathing, but you take big breaths as you're doing that slow breathing, you're going to still be breathing inefficiently because you're taking in way more air than you need. You want to breathe lightly and you want to breathe deep. So if you think of this kind of like a jellyfish, you can put your hands on each side of your ribs. And then as you inhale, have your hands on your ribs and inhale and feel the hands go out as you take a breath in, and picture that jellyfish, and then exhale and feel your hands come in. So then again, you're going to inhale and your hands go up, and exhale and your hands would go down. And so as you're doing that, if you are breathing with your actual breathing muscle or your diaphragm, you're going to increase your lung volume, You're going to stiffen the airway, and that's related to upper airway recruitment. So increased lung volume is kind of how the CPAP works as well. So you have that air coming through, it keeps the lungs full, which automatically triggers those muscles in the pharynx to stiffen the airway and keep it from collapsing. It gets air down to the air sacs for gas exchange, which is related to that loop gain and that carbon dioxide sensitivity. But the only place that we have those little air sacs to exchange the gas is way down in the bottom of our lungs. And so if we're always breathing up in the chest and rapidly through our mouth, then we're not going to be getting the benefit of all that gas exchange. It also activates the vagus nerve and signals the rest and digest system, which is related to your arousal threshold. So what can you do? You can close your mouth. And this is a fantastic book. This is basically the first one that I ever started with, and a huge inspiration as to why I became a breathing instructor. But if you can breathe through your mouth, or that's wrong. If you can breathe through your nose for 1 minute, you can breathe through your nose for life. So what can you do to breathe through your nose? It's a habit a lot of times. And if you can breathe through your nose, then you want to start breathing through your nose, but you can't automatically do that. You can use some mouth tape. 3M micropore is fantastic. What I love about myotape is that it goes around your mouth instead of across it. And so you're able to still talk, open your mouth, all sorts of things. You can also, I commonly use, look, I have show and tell here. I commonly just use this sort of tape with just a kinetic tape, and I cut it into strips. And then I take those strips and I do essentially the same thing. And I can show you in the question and answer if you want, and put it around my lips on each side. If your nose is stuffy, sometimes you can use a nasal dilator or breathe right strips. So if you want to see if that might help, you can put one finger on each side of your nose and sort of pull it apart and see if that makes it easier to breathe. So let me see if I can switch it here so that you can see what I mean. So essentially you can go like this. And if that makes it easier for you to breathe, then a nasal dilator or breathe right strip might help. Another thing that I love is Sclera nasal spray. So it's a Xylitol nasal spray. Xylitol is fantastic. It helps with allergies. It helps to fight COVID and flu virus, all sorts of stuff. But it's a natural sugar. It also helps to fight cavities. I use it. My kids use it. You can do mild functional therapy, and then you can also do an exercise to decongest the nose. So I'll run through that with you really quickly, and I can show you a QR code if you want. You can find it on YouTube too. But essentially, you're going to breathe in and out of your nose regularly. And then after you breathe in and out of your nose, you're going to pinch your nose, and you're going to nod your head up and down as many times as you can until you feel like you have to take a breath. And then when you have to take a breath, you're going to let go of your nose, and you're going to breathe through your nose. So this is trying to create a bit of an air hunger. So it's not that first desire to breathe. You're going past that, but you still want to be able to let go, breathe through your nose, and you should be able to recover in just a couple breaths and then be able to breathe normally. And that usually will help cool that nitric oxide, open up the airway. You can do that up to 6 times right before going to bed. Wait about 30 seconds to a minute in between, and hopefully that helps to open up the airway for you. If you are pregnant or if you have heart conditions, you don't want to do strong breath holds, and that's something that we would work together on to figure out which exercises are best. So let me go back to here because I think I'm just about done. Oh yeah, so it's Never One Thing, and this is another book that I love. It's Why We Sleep, and I'm just going to go through some tips for sleeping. And trust me, I am not perfect at sleeping. I'm not perfect at breathing, but I love this book because it talks about sleep from the perspective of not just sleep disorder breathing, not just sleep apnea. Everybody probably has a little bit of dysfunction to their sleep because we're in a society where it's always go, go, go. And we have, all of our cell phones that are constantly in our hands. And so here's some things that you can hopefully put into place, whatever works in your life. But some of the tips would be to stick to a regular bedtime and wake up time, even on the weekends, to get your body used to it. You do want to exercise, but you want to try to finish at least 2 to 3 hours before bedtime so that then you can sort of down regulate. You want to reduce caffeine intake. And trust me, I have to have coffee in the morning, but especially late in the day, it takes about 8 hours for it to wear off. And that can even include chocolate. You want to quit smoking. There's so many reasons to quit smoking. And I know it's not easy, but just another thing is that nicotine is a stimulant, so it can actually keep you awake. You want to avoid large meals and a lot of liquid late at night. Obviously, you don't want to be having to get up to go to the bathroom. You want to avoid medications that can disrupt your sleep if possible. So that can include, there are a lot of asthma medications or sometimes heart medications that can affect your sleep. And if that's the case, then you may want to talk with your physician about, can I take it in the morning instead of taking it at night? You want to avoid alcohol before bed. Now, I like having red wine, for example, but I have definitely noticed that it affects my sleep. And the thing with alcohol is that it will help you go to sleep a lot of times, but you don't have natural sleep. It's almost like sedation. And so you fall asleep into this sort of twilight sleep. You wake up frequently. It makes it harder for you to go into REM sleep, and it relaxes your muscles. So if you are prone to your airway collapsing, you're going to be much more likely that your airway does collapse. So I've definitely noticed that I don't feel as good in the morning if I have a glass of wine. So, I just figure maybe that means that I need to go to brunch and have a mimosa or something. Anyway, figure out how it fits in your life, and no one's perfect. But go to bed only when sleepy, and try not to fall asleep on the couch. Have a cool, dark bedroom. Keep screens out of the bedroom. And if you can't sleep, get out of bed. So I do this all the time. If I can't sleep those nights that my mind is racing, I think, okay, well, I might as well get out of bed and do something. But that's not exactly what I should be doing. So usually I'll go to my computer and I'll start working, but you really want to try to do something quiet and relaxing so that when you are feeling sleepy again, then you can go back to your bed and you associate your bed with sleep. You want to avoid naps after 3 p.m. Take a hot bath before bed because it dilates all that blood in your system so that you can kind of cool down. And you want to remove clock faces from view. So I had this clock that was projecting up onto my ceiling, and nothing's worse than waking up and looking and going, oh, I have so many, such and such hours still left to sleep. It creates a little bit of anxiety around it. So this is the last thing, just a review. If you think you have sleep apnea, talk with your physician about getting a sleep study. Sleep apnea is largely undiagnosed, and untreated sleep apnea is dangerous. There are 4 phenotypes of sleep apnea, and only one of them is actually related to structure. So there are a lot of things that you can do to improve your sleep, including breath retraining, and it can be used as an adjunct for treatment with options such as positive airway pressure, mandibular advancement devices, surgical intervention, and breath retraining. And how you breathe during the day affects how you breathe at night. So establishing functional breathing during the day can positively affect breathing at night and all 4 phenotypes of obstructive sleep apnea. So I think of it kind of like, when you work out and you get more tone in your muscles, that can stay there throughout the night. It's the same sort of thing, like a muscle memory when you work on your breathing during the day and when you work with myofunctional therapy and strengthening those muscles. So with that, I'm going to ask if there are any questions, and I appreciate all of your patience with my technical difficulties here, and feel free to unmute yourselves because I don't think I have you muted in any way. And I will just flip it back to me here. Okay.
Hi, Dr. Casey, or
Hi.
Dr. Jones. This is Laura.
Hi, how are you?
Good. I have a question for you. I'm a patient of Dr. Loud's, and I'm seeing a suggestion. I'm seeing Tabitha regarding what we've noticed on some thermal imaging that was done on me.
Yeah.
Are you familiar with that?
Some thermal, I cannot speak to that actually. I'm sorry.
Well, it seems that there's a lot of inflammation, sort of redness that shows up on this image around my neck and chest.
Okay.
And I do believe I can fall asleep, but I cannot stay asleep.
Okay.
So I do believe there's something going on.
Okay.
And she made the suggestion when she watched me breathing that I do take a little bit more in at the chest and not just in the abdomen, to try to release some of that inflammation, possibly up in the neck area and upper chest that they see on these images.
So her suggestion was actually that you're doing chest breathing instead of breathing from your diaphragm?
Well, maybe not instead of, but possibly along with it a little bit more, in the idea that you could possibly release some of this. She just thinks I'm holding on to too much up there, and maybe the breath going through there would, release a little along with the abdomen. I mean, she's not saying totally.
Sure. Yeah, I think I understand what you're saying, and I've seen it a little bit. I'm certainly not an expert, but what I think you're referring to is that we want to be breathing. Let me see if I can stand up. So if you're breathing from you can think of it in 3 dimensions, right? So you're breathing from low and in your diaphragm, but you also want to breathe through the whole thing. So it's not just about your belly going out. It's not just about your ribs going to the side. They're going to expand to the back, and everything's going to kind of expand up top too. So it's more of like a dynamic sort of playful, opening up of everything, more relaxed than kind of holding on to the tension. And everything's all connected. So maybe that's a little bit of what she was referring to. Does that make sense?
Yeah, that makes sense, because I guess it's like you say, think about your abdomen and then think about your chest, but what you're getting at is think about the whole thing kind of in conjunction with each other.
Yeah, you absolutely can. I mean, that's coming not specifically from Oxygen Advantage or Buteyko, but as a dancer and someone who thinks that it's all kind of related, and the more playful you can be with things, and the more loose that you can be. There's someone called I believe it's Petra Fisher that's on Instagram, and I've started following her, and she does something called CARS, which is goodness, I wish I could remember. I think it's Capsular Articular Rotation Series. So you go through every joint in the body and essentially, roll it ways to be everything, kind of with the hunter-gatherer of idea to it. And we're just, as we're stiff and, in desk jobs or whatever, we're holding a lot of tension, and our posture is so different than, which really should be with being stacked up. And so, working on the posture along with the breathing, because it's all connected. Your diaphragm is also connected to your pelvic floor. So if you have a tight pelvic floor, that can also affect things all the way up to the neck, include, neck pain. It can be related to the tongue tie because it's the whole neural tube and everything. So it's
makes sense. That makes a lot of sense. Thank you.
Oh, you're so welcome. Thanks for asking the question. Does anybody else have some questions? Again, I really appreciate everyone's patience. I'm sorry that my presentation did not turn out exactly the way that I intended. Technology got the best of me today.
It happens, but you handled it well. We still got the information. So
Fair.
Thank you.
Absolutely. Does anybody else have any questions?
I do. I'm always devil's advocate. So if somebody starts this type of breathing, how long would they have to practice? If they start practicing Buteyko breathing and really creating healthy breathing habits, how long till they start noticing a difference in their fatigue and sleep apnea, possibly? I guess the goal would be to help someone prevent worsening sleep apnea, because over time those CPAPs tend to not work so well, and sleep apnea worsens. They gain more weight, they get more fatigue, more hypoxia. So the cells don't work, and they end up with all kind of chronic conditions.
Yes. And so there's a lot in that question. So yes, absolutely. Over time. So on that spectrum, you can also start with the snoring. And then if you do nothing, you can progress and over time end up with having sleep apnea if you're prone to having it. And it's connected to so many things. And the current treatments are kind of like wearing glasses, right? So if you have a CPAP, but you don't use it, is not giving you any benefit. And so oftentimes people would start off with the CPAP, but it is a compliance issue because there's so much to it. You have to clean it. If you get up to go to the bathroom, you take it off, you have to put it back on. So sometimes they just end up in the closet and they're not being used. There's also people who have trouble tolerating it. And sometimes it's because, they're breathing through their mouth. And so things get really dried out and it's just harder to breathe. So even for something like that, it would be helpful to learn to close the mouth at night and breathe through the nose. And even with a CPAP to be able to breathe functionally. And so to answer your question, it depends on where you're starting with your BOLT score or controlled pause. But you can see an increase. And typically for every 5 seconds that you see an increase in that controlled pause as you're measuring it, and you can measure it, the best time to measure it is in the morning. You just kind of sit up from bed, you take a few breaths, measure it, see what it is, and record it. And as it increases every every time it goes up 5 seconds, you'll usually notice a difference in how you feel and how you're sleeping. And once you get up past 25, you notice a pretty big difference in how you're feeling. And that's sort of the benchmark that I know Patrick McEwen tends to use is above 25, especially for someone with sleep apnea. And then you can kind of go back to your physician and you have another sleep study. That's really the only way to know. There's anecdotal, yes, you're feeling better, but are you really actually now being able to breathe? Can the CPAP be adjusted? Can anything be changed about what you're already doing? Did that answer it?
Yeah. And then another question, if somebody's dealing with chronic nasal obstruction and they can't really get off Afrin, how can you help someone like that?
So Afrin is one that is really meant to only be used for several days at a time because it is addicting. It does have that rebound stuffiness. And if you look on the back, it says to only use it. I think it's for 3 days. But that's why I love something like, the Xlera, the Xylitol nasal spray. It's got my initials on it, so my kids know it's mine. So this is something that you can use, 2 to 4 sprays each nostril. You can use it as many times as you want, really, because it's that natural sugar. And so that I think is something that helps a ton. It's also so counterintuitive, but people who tend to have a stuffy nose will often blow their nose. And the more that you blow your nose, you're going to cause more inflammation in there. And so if you can change the habit to stop blowing your nose as often, you'll reduce the inflammation that's happening in there and change things like that. I would also say trying the nasal clearing thing, as long as you're not pregnant or have, heart disease, to hold your breath and nod your head up and down. You can do breath holds that are small and gentle, like 5 seconds at a time. You never want to go more than half of your BOLT score when you're holding your breath. But as you're holding your breath and nodding your head up and down, you can do that 6 times. The more that you breathe through your nose, the more you're going to be able to breathe through your nose. And when you've been doing it for like 20 years, let's say, of breathing through your nose, it's not going to automatically.
Sorry.
Bless you.
Allergies this year have been so bad. That happens to every time I go running outside. It's just everything is blooming, it's beautiful, but I've never had allergies like this year. Never.
Yeah, allergies can be bad in Arizona. And so a question for you then is that, have you started to try to actually breathe through your nose as you're exercising too?
Yeah, I do. I run at a pace where I can, I switch to nasal breathing only.
Awesome.
Yeah, no matter what I do. If I have to slow down, I slow it down, but I don't breathe through my mouth at all.
Yeah.
That's why when I come back, I get this rebound here because it was so dry running, and I come back and it just starts sneezing now.
Some people don't realize that you can and should be breathing through your nose as you're exercising. And
Yeah.
sometimes it does mean taking it down at first, but it helps the recovery. Even my husband, he had, he would just really struggle if it was cold outside and he would want to go running, but it would almost trigger like asthma for him. And when he switched to breathing through his nose, now he can jog because he's humidifying that air and moisturizing it and warming it as it's coming in is what I'm meaning to say. So as he warms the air, it's less likely to irritate the airways. And he noticed that he recovers more quickly. So if you're, breathing through your nose, you're going to be recovering. Or
I take quercetin, but it doesn't do anything. This year has been so bad, and I've heard that from everyone.
yeah. Well,
Yeah.
Unfortunately, there are allergies, and sometimes it's a matter of figuring out what they are. And when I lived in Arizona, since I was born and raised there, I was allergic to grass, cats, and trees. And so it was like life, everything out there, everything blooming. And so I actually asked my mom when I think I started at 11, and I asked her if I could get allergy shots because I was so tired of taking 2 allergy medications, 2 nasal sprays. It was just, and it made such a huge difference. So I did that for years, but now I don't get allergies nearly as much as I used to.
And could you talk maybe about the mouth taping and how can people wrap their head around that?
Absolutely. Yep. Here, let me put this down so I can do a little show and tell.
Let
I've
me see
got
if
a
there's
couple
other
of-
questions in the chat, maybe.
Oh yeah. I didn't even look at
No
that.
questions, okay.
So,
Can you bring
so
me a tissue, please?
there's a lot of ways to do it. So this has been my favorite way lately. This is the kinetic tape that you get for like physical therapy, and you can get it for sensitive skin. And I thought I had the box down here, but it doesn't matter what brand, you can get lots of them. And then I cut it into strips. And for me, I take the strip, and sometimes, like I've said before, you can, if you can get it off, you can put it against your nightgown or shirt or whatever if it's a little sticky. And then sometimes you can just take one and put it on the bottom of the mouth. And sometimes that alone is enough to remind the lips to close and keep it closed. And especially in kids, that's one way to do it. But then you can take another strip and you can get the tape off here. And you can take that piece and you can make it almost like that myo tape. So then it goes around like this. So you've got one going this way, one going this way. So you can still obviously talk, open your mouth, drink, whatever, but it just has enough elastic there that it reminds your lips to close. And usually that's enough to keep your lips closed. And, you could do this with kids or yourself during the day as you're trying to relearn the habit, because if you're sitting at the computer or watching TV and you just have that habit of having your mouth open, it's hard to remember and to catch yourself. So this can be that reminder. You can also wear it at night. There's this type, which is, this is the child size. It comes in 3 sizes for the myo tape, but there's small, medium, and large. If you're an adult, you definitely need large. Even for my 11-year-old, he would wear a large, but there's little kid sizes of it and even smaller than that. You can also take 3M micropore tape, which I love. I don't have that down here with me, but you can even just take a tiny little piece of it like this and just put it right in the front of the lips here. And you can still breathe through the sides here if you needed to, but really all you need is a reminder for those lips to stay closed. You certainly can go all the way across the lips, more like this. And I've done that too, but you don't have to, because once you do that, you can't talk, you can't do anything. And so that's just piece of paper, not tape. But there's tons of different ways to do it. There's lots of videos on YouTube, and I've shared a video. There's some on social media too that goes through the different ways to take your mouth. So I do it every night. I don't know. Do you know?
I was just going to ask,
I
so
do,
it sounds like
yeah.
you're pretty well trained. So even though you're well trained in your breathing, it's still beneficial to put the tape on just to make sure. Okay.
For me, it is. For me,
Okay.
I know that because of the way that my jaws are, and I am just prone to collapse of my airway because I have a really long soft palate and stuff. So if I to my back, I will actually stop breathing 17.5 times an hour based on my sleep. So, and that would qualify then if I was on my back, that would qualify moderate sleep apnea, but I don't usually sleep on my back. It's just a fluke if I do. So on my side, I'm better. But since I know that that can happen, if I don't wear it, I still will wake up and my mouth will be open. And so it is something that I still use.
Okay, cool.
I do it too. We do it. We both do it. My husband and I. We look pretty funny, but it you know, as you age, your muscles drop more in your deep sleep, especially on your back, and it really helps. And I sleep better, deeper.
Absolutely. Because if that mouth is closed, there's just a much likelier chance that that tongue is in the right position to not be falling back. So yeah, it's a huge difference. And as you open your jaw, even if you're making sleep appliances for people, so even if we're trying to move the jaw forward, almost like that CPR sort of action for people, we don't want to open them too far, because studies have shown that as we open them, it actually closes the airway more, because it makes your jaw moves down and back as you open, and it closes off the airway. So it's kind of just a little and then moving it forward so you're not closing it off.
And people that have like open bites where you can't bite into things with your front teeth, they're even more prone to their lips opening up, lip incompetence.
Absolutely. Let's see. Yeah, I don't think that there are any in the chat that I see.
Well, thank you. And how can we work with you if we want to work on some breathing techniques and kind of improving our function?
Yeah,
the
absolutely.
most important thing, we can't live without breath.
Right.
But that breath is so important. So if you want to work with me, I do one-on-one trainings through Zoom. I also am going to be setting up a group training through Zoom. And so, you know, up to maybe 10 people in May, and that can be a 4-week session. So if you're interested, you can just shoot me a quick email so that I can connect with you, and you can reach me at Casey, CASEY, at Dr. Casey Jones, DrCaseyJones.com. And you can reach me on social media too. So I'll just flip this around so you can kind of see this part here. There you go. And so this has my contact information there. I can't remember what that QR code is for. It's one of the YouTube videos, but I've got some stuff, some videos, including the one before this on YouTube. And since this one wasn't so great with all my technical difficulties, maybe I'll do the talk and record that and put that on YouTube for anybody that missed it, but it'll essentially be the same thing. So some great questions though. All right, anything else? Oh,
I think you
lose-
might need a glass of wine tonight. Sleep or no sleep, I think you're gonna need it after this.
Oh, thank you. I love that. I love that.
Thank you
Well,
so much.
thank you so much for being here. I appreciate it. Should we call it did I lose Dr. Loud? We've still
I
got
still
a
see
few.
her.
I still see her too. Anybody else have any questions for me? Well, if there's, go
Can
ahead.
you tell me again what kind of tape that was?
Yes, the one that I like, my favorite lately.
Yes.
Yes, so it's basically, I think it's called kinesiology tape or kinetic tape. And it's basically for physical therapy. They use it to like tape the muscles. So it's kind of stretchy to it. And let me see if I did bring oh yeah, here's an example. It's not the only type that you could get by any means, but this was Spider Tech Gentle, because I have super sensitive skin. And so as much as I love the myotape, sometimes for me, it will actually be too strong and it will irritate the tissue around my lips. And so this does essentially the same sort of thing, but doesn't seem to cause sensitivity around my mouth. So I just order whichever one seems to be a good deal on Amazon that's for sensitive skin specifically. And then it comes looking like this. This is what I've been doing lately. Comes looking like this. And then, like I said, I just cut it into strips. So you could cut it into 2 or 3 and just kind of play around with whatever feels comfortable for you. And there's usually this on the back, and then it's the stretchy stuff on the front. And then you just stretch that around.
Okay, thank you. Great.
But the other types that you can use, there's so many different ones out there. 3M micropore tape is great, and I use that too. And it's really inexpensive. It's that white tape that you can use little pieces of. And then, like I said, the Myo tape is fantastic too. It's just, I have ridiculously sensitive skin. So.
Well, I do too.
Yeah.
Thank you.
You're welcome. Any other questions before we call it a night? And I probably do go get that glass of wine. Just kidding. Who knows? Any other questions? Well, I appreciate everyone that stuck with it. I can't thank you enough for being patient with me, for being willing to listen. And I am just passionate about sharing this information because I think it's important. I think that breathing is important. I think that sleep is important. We all need to do it every day. And breathing is something where, if you work on changing your breathing, it's something you're already doing all day, every day. And so it's not like we're asking you to change your diet. We're not asking you to change your exercise routine. We're just asking you to be aware and breathe differently and find ways to fit that into your life daily. And then notice how that changes how you feel. Because if you're missing out on sleep, it's so much harder for other things. You're going to have your hormones all out of whack. You're going to be more hungry. And so it's a vicious cycle because sometimes you're eating more and then you're gaining weight, and then that's putting weight on for your tongue. You can actually gain fat in your tongue, which is crazy to me, but you can gain fat anywhere and in your neck. And so then that can close off your airway even more. So it's all connected. I'm always happy to answer questions. Reach out to me if you want to connect and know anything more. And thank you again. So have a wonderful, wonderful day. I'm going to check that. I think Dr. Loud is here, but she's muted and her
I'm
yeah.
here.
Oh, okay. I was just going to stop. And so any other questions for
Well,
today?
thank you.
Well,
No,
thank
I
you.
think
I appreciate it.
you're welcome. It was fantastic.
Mhm.
Thank you so much.
Rest of your night. Don't
Have
forget
a
to
happy Easter.
all right. Take care. Happy
Thank
Easter.
you.
to
Bye. Happy
Bye.
Easter.